Hi everyone, welcome to my channel. My name is Erica. I am a healthcare administrative student at American Public University, and I would like to go over why I chose the Telehealth Infrastructure Program as the policy that I most support, and I feel like it is most important to the state of South Carolina and all other surrounding areas as well, not just particular to where I'm at currently. So I support this because it brings me back to the pandemic whenever we were all being seen via telehealth visits. We were all getting on our phones and, being triaged and being able to see our providers and seek the care that we need and fill our prescriptions that we needed for any kind of sicknesses that we were having. So I feel like with the advancement of technology, this is one of the things that is going to continue to grow, and I feel like it will be very beneficial to this state and all other states if we can make the investment to increase our telehealth infrastructure and really put in the work for our patients to be able to be seen whenever there are barriers such as transportation or any other barriers to healthcare that we're experiencing. So why this policy? There is a challenge stated before that the rural and underserved areas are not able to be seen because they may live out further from the town or wherever their appointments are. So why not decrease the time by being able to just pick up the phone, which is what everyone's doing anyway right now, right? So pick up the phone, call your provider, get on there, tell them the issues that you're having, and you're able to get those issues addressed and you're able to get the treatment that you need. So we can also bridge the gap whenever it comes to using telehealth between the communities and the clinicians by ensuring that they have equitable access to care and that nobody's left behind, because what we don't want in our healthcare system is for somebody not to be able to seek the care that they need because they can't get to their appointment or they can't leave work because they can't afford to miss the time. So this is going to be one of the most important policies that I feel is going to be very beneficial. This policy is a game changer for clinicians for the simple fact of they are able to expand their care to other people in other areas. You can be in a whole other state and receive specialty care if you want. I mean, the list goes on, right? So you're also able to decrease the burnout from the providers because they are able to be in their offices and not worried about, oh, I have to go to this room to see this next patient, but this patient's been waiting this long. It just, it decreases all that. So we want to ensure that we do that because our providers work very hard to make sure that people are being able to be seen and get the treatment that they need. And it also allows them to do follow-up care. So in the event that you don't want to leave work for a 20-minute follow-up care appointment, you're able to just get on that phone once again and talk to your provider. So that is one of the things that I feel that is very important when discussing this telehealth infrastructure policy. Now, the selling point for this policy is that this policy is directly impacting the access, the equity, and the outcomes of our patients. And that is our goal as healthcare managers, executive managers of hospitals. That is always going to be the goal, that everybody receives the same amount of care and that we enhance the outcomes for our patients so that they can live longer and they can enjoy their lives without having to worry about, oh, I'm having this issue with my health. So by putting the right tools in the hands of the providers and the patients, we are able to limit the barriers that we have for transportation, not being able to leave work, or any other barriers to healthcare that we're having and then we're experiencing, because we don't ever want that to be an issue. We're also decreasing the cost of healthcare, believe it or not. We're able to increase the time that providers are able to get in there and say, address all the needs for our patients on these telehealth visits, because that's a big thing. Even in the state of South Carolina, from some of the research that I've conducted, that's one of the biggest things. And then we support the workforce that is sitting there working hard with our providers being stretched thin. They're not being stretched so thin. They're able to kind of chill, take care of the patients, and really focus on those telehealth visits. And so that is why I decided to support this policy. So, in a nutshell, the infrastructure program is going to strengthen the healthcare system in South Carolina. It is also going to ensure that patients receive care no matter where they are or any kind of barriers they may have. It's really going to ensure that this is one of the issues that we tackle and take care of. I feel like that COVID-19 really allowed us to see the benefits of telehealth and what it can do for our healthcare system, because we were able to be seen. And now, as technology advances even more in the future, we're able to incorporate AI and all these other different platforms. And I feel like it's going to continue to grow. And I feel like it's really going to be an exciting future for healthcare when we really start to focus on being able to be time efficient and not waste time, and be able to address care needs from patients being in the comfort of their own homes. This is really going to be beneficial for everyone. And I'm very excited for the future. I hope that this continues to expand throughout even the next coming years. And I feel like everyone's going to be pretty excited about this as well. So, that being said, if you liked what I talked about today, don't forget to like, share, and subscribe. And also tune in for more healthcare policy conversations with me if you would like. And we are going to talk about how these policies impact our real world, because at the end of the day, we're always talking about what's happening in the real world. And this is going to be one of the most important issues that we're going to have to address in the healthcare system. So, thanks for watching. Enjoy your evening. Thank you.